soon as you remove the skin, you come across this skull. Yeah, these are musculatures and anterior. This no very ophthalmic superficialis. Take a lateral cut here, very carefully, superficial till the eye, because here many nerves are there, those are important. This is eye orbit. And remove the skin. To use strong forceps to pull out the skin. So when you remove the skin, you will find olfactory chamber below. This black color is olfactory chamber. Okay, and beneath the nostril is there. See how to confirm with the help of nostril. See, it is leading in the chamber, and here you can see white color lobes. These are olfactory lobes which are attached to chambers. So remove this. And this vagus, ophthalmic is here. This one, superficialis, and below that you will find the olfactory nerve. So olfactory nerve enters from, it originates from the lobe and enters from the cartilage. This is cartilage that is separating brain from the olfactory chamber, and that's why here this cartilage is to be broken. That is very risky. You will have to take a lot of care, because if you pull out this entire cartilage, it will break the olfactory peduncle. Olfactory nerve is called as olfactory peduncle. Behind, just remove this also, so both the sides will be clear. Peeling off, holding the corner of the skin and remove it. Peeling off is easy. Musculature are attached, so you will take care, and particularly here at the gill region. As far as skin is coming alone, there is no problem, but the moment it is attached to the muscle, you will have to take care. Here they are attached to the muscle, so scrape it. After scraping, skin can come easily then, like this. Go anteriorwards, remove the skull. You will find skull, then the ophthalmic superficialis again here. This one, and color is yellowish here. Because of preservation, it becomes yellowish. In non-preserved condition, they are silvery white, shining. Luster is there in fresh condition. I'll remove this skin. Again, I'll take the peripheral cut. Scissor. the skin. Okay, this is easy, but here we'll have to take care, let us say, because many important nerves are here. Maxillaries, mandibularis, mandibular. So here you take very superficial cut and go ahead. Slowly pull out the skin without muscle. Okay. So this way, muscle should not come along. Least amount of muscle should come. Now we are ready for the dissection. If you remove this membrane, you find olfactory chamber. Okay, this is how olfactory chamber is visible, and this is orbit here on either side. Orbits, two olfactory chambers. These are ophthalmic superficialis, and this is skull. Skull has anterior this membranous part. This is delicate covering cerebellum. Then optic lobes are opposite to orbits. Here optic lobes, then cerebellum, oblongata, and spinal cord. First of all, we will go deeper here to find the oblongata. For oblongata, you need not take much effort. Only remove these muscles which are attached to the skulls. Slowly. And peel it off. These muscles are hiding beneath. Actually, these muscles cover the vertebral column. We need not go so very posterior side. Here only we come across vertebral column. So as soon as you finish your peeling, you will find a hard structure here, this one. If you touch it, you can touch it. This is a vertebral column. This entire region. I'll just show. So this is hard structure. So you need not bother to lose the oblongata. Oblongata will be there. And this skull, there is lot of membrane. These membranes are tough. See this membrane, you have to remove carefully before you find the skull beneath. Clean it nicely. These are musculatures. You can now, with the help of the color of this nerve, you can make out the difference between the muscle and the nerves. So these are muscles, little pinkish. Remove them. This is also cover of muscle. Okay, like this. Some membranous part like this. Okay. And as you go digging beneath, you will find nerves are there. These nerves which are found, they are very superficial here on the lateral side. Maxillaries will go to maxilla. This is maxilla. Okay. Maxilla means upper jaw. And mandible is lower jaw. So mandibularis will go to lower jaw. Maxillaris will go. So maxillary superficial, maxillary inferior, all will be seen here. As soon as this skin is peeled off, you will take care here. You are not losing any muscle here. Only skin you have to take out. If something is attached, you should cut with help of scissor, like this, and release the skin. While releasing, some muscle will come. This is muscle. This is not a nerve, so you need not bother. Okay, this is how you can expose the lower part, and then you search for nerves. You have to remove this membrane, and you will find some yellow structure here. These are nerves. So this is mandibular external mandibular. This is branch from the C. Okay, and there is one more branch which is going from here. Is hyomandibular. I can show you the mandibular external or external mandibularis, this one. And here somewhere you will find maxillaris. Can you see a branch going ahead, anterior side? This is maxillaris. This is maxillaris inferior. Okay, the branch which is separating from the mandibular externus, you will find maxillary mandibular externus, and this is maxillaris inferior. Okay, this is all, and you have to clear this with the help of forceps, clearing these muscles as they go deeper here. Can you see how I am tracing? Very easy. This is common nerve. This common nerve gives two branches. One is maxillary and other is mandibulary. And here another branch you will find is a hyomandibularis. Hyomandibularis goes downwards, and here it goes to in the middle of the mandible. Now when you remove this, you will find one more branch which is growing to maxilla, called as maxillaris. Maxillaris superior or superior maxilla. Superior. Can you see this now? This is how it gives out one more branch, that is bacchalis, or I'll show you. Are you okay? Now can you see this? No. This is very clear and shining white color here. That is how it goes to what? Maxilla. So it is superficial maxillar, and maxillar inferior, just now I showed you the branch from here. Just now I lost, I think. Remove this musculature. Just now I lost here. Number P. Okay, ठीक है. Then if you remove this orbit, you will find optic nerve. This is eyeball, and there are so many nerves attached. So one of them is very thick and that is attached. These are musculatures. These are orbital muscles. So if I remove this muscle like this, these are musculatures for moving the eyes. Oculomotor. Now you can see a nerve here which is white in color. This is optic nerve. Okay. I must remove this eyeball because we don't need this optic nerve. For today's dissection, we have to concentrate on 5th, 7th, 9th and 10th. So there is ophthalmic inferior, this side, below optic nerve. This is inferior, and there is buccalis. Lower branch is buccalis and upper branch is inferior. This is superior, ophthalmic superior, and this is inferior. And below that, one branch goes to inner side of the mouth called as buccalis. So two branches are there. Actually, this inferior is variously branched. Only one branch which is going to the buccal chamber is called as buccalis. And palatine is running parallel. This is this is optic nerve. This one. Just now I cut the orbit from here. This the palatine runs from the lower side and between this cartilage. This is mound of cartilage. This is crest. So between this ophthalmic and this one, you will find you have to bend this cartilage to see nerve beneath. There is a small branch you will find. Here. This is thin branch. That is palatine. So as soon as you don't disturb this area must not be disturbed because this is very delicate and small nerve. You have to bend down this cartilage, and here you will find a fine thread-like structure. This is palatine. It goes to palate. And now coming to this hyomandibular, we have done hyomandibular, we have to trace out. Okay. It should be in the groove of lower jaw. See this groove, can you see this groove? This maxillaris goes there. Hyomandibular also is in there. Hyomandibular is a branch of this. It is written wrongly here. Hypo. It is not hypo. It is hyo. This is. There are three branches: mandibular proper, then mandibular internus, and hyomandibular. Three branches. We'll try to see all these three branches here. lot many membranes which cover these nerves. So you have to try to see this right. When you remove this membrane slowly, sometimes it may happen that you have pulled out the nerves. So here you'll take care of the nerve. They are very thin nerves. See, hyomandibular is here, and that goes in the groove of this jaw, lower jaw. So this, whenever we pull this skin, that time it may break. So that time you have to take care. So mandibular pauper, and this is mandibular internus. So they are very superficial nerves. So here what happened, when we pulled out this skin, that has lost. So this you have to take care, you are retaining that. Now these are gills, 1, 2, 3, 4 and 5. And there is a vagus which gives us the visceralis and lateralis. Let us find the vagus now. If you just stretch it out, this muscle you need not remove. As soon as you stretch it out, you will find the vagus. Okay? This is vagus. This is visceralis and this is lateralis.
Lateralis. Hyobranchial.
And then here you will find the network of branches going to the gills. As this specimen is very small, it will become difficult to find this very thin nerves in this specimen particularly. Usually they are very superficial and very visible, but we'll try to trace out. Yeah, I have come to the nerves now. The vagus will give lateralis and visceralis. Visceralis will give the branches to the gills. Now here I can show you one of the branch which is sprouting from the visceralis. This is visceralis, lower one, upper one is lateralis. See, this is one branch. Here one branch is there, and another branch is here. Okay, these are branchial. Branchial goes to gills, and branchial will again give two branches. Anterior one is called as pre-traumatic, and posterior one is called as post-traumatic. So branchial nerves. Here one of them I have lifted on the tip of my scissor like this, and another here. So dependent on the number where it goes, it may be called as first, second, third, fourth, fifth. So this is going to fourth, this one is going to fourth, so this is fourth branchial. This is going to third, so this is third branchial. Like that you have to trace all the branchials slowly with a proper light. We have poor light here, so that becomes a little difficult. Let us find. You need not break this brain because these branches are here outside only. They are coming, all are coming out of the cranium, so they are known as cranial nerves. So again, let us revise. This is ophthalmic superficialis, like this. When you bend it, you will find the olfactory chambers. This chamber is open here. This is bean shape on either side, and at the bottom here behind you will find olfactory lobes, and olfactory lobes will give nerve which is called as olfactory nerve. This olfactory nerve goes and attaches to the anterior part of brain, cerebrum. Then here you will find optic lobes, and because of that you will find the optic nerve which is coming out of. Beneath the brain there is optic chiasma, and this is cerebellum. Now let us see medulla oblongata. So this hard part is nothing but vertebral column. We know that vertebral column protects our nerve cord, spinal nerve cord. So what you have to do, you have to break open this vertebral column. Again, if you use pointed forceps, it will be, and that pointed forceps should also be very strong. BB forceps. Okay. There are many ligaments which are attached. I have just pulled out small bit of vertebral column. This is tubular inside, and inside you will find the oblongata. This is very delicate. You will take care of inner part. Only superficial vertebral column you have to break slowly. Okay, getting my point? This is vertebral column I have broken to find the oblongata. And that is spinal cord. Medulla oblongata is anterior wards. Okay, this is fine. So these bits will spring up. So take care of your eyes, huh? Please. Let me let me remove this first of all. Yeah. Sometimes scissors also help for crushing this very tough. If you use blunt forceps, it will help to save the brain and also help to crush the skull. This is cartilaginous, so it can be broken very easily. Okay, like this. You need to apply little strength. So this anterior part which is attached to the brain is called as medulla oblongata. So how much time I have taken? 9:30 to 10.
34 minutes.
34 minutes. So this is the you have to maintain such speed. Before 11:10 we must finish our dissection today.
एक्झामिनर काय विचारणार?
हे ब्रांचेस हे जे ऑप्थॅल्मिक आहे हे जे जेवढं दाखवले सगळे विचारणार. याच्यात फक्त ऑप्टिक सोडून
ऑप्टिक नाही
जेवढं आहे सगळे दाखवले मी. फक्त यातले ऑल ब्रांचेस ब्रँकियल ब्रांचेस आय हॅव नॉट शोन. यू हॅव टू ट्रेस आउट.
कंपल्सरी
कंपल्सरी हा किंवा सेपिया कंपल्सरी एक येणार. So this is very that way difficult compared to sepia. Sepia is easy because that musculature removal is very simple. Here because of this cartilage and ligaments it becomes difficult. So you'll remember the medulla oblongata here, and this is spinal cord. Let us revise. Number 1, ophthalmic superior. Then olfactory chamber, olfactory lobes, and below that we had come across one of the ophthalmic which is called as inferior and buccalis. See this one. Okay. This one is ophthalmic inferior, and one of the branch which is going downwards. Here bifurcation you come across, and upper and lower. This bifurcation, upper one is inferior and this is buccalis. Okay. And then another branch which gives out here, this gives two branches. One is that is maxillaris and the mandibularis. One separate branch goes from here. See, this one is maxillaris proper. You need not trace it very clear, because the moment you try to trace it, it may lose this nerve, because there is a lot of confusion between the musculature, membranes and the nerves. So here you can put a black paper below this showing the maxilla, and this is mandibular because it goes to lower jaw. And here you come across another nerve which goes to mandible. So this mandibular externus, and this is giving three branches. This branch will give three branches here. One will go anteriorwards, called as mandibular proper, and below two branches are there. One is mandibular, lowest one, and the middle one is called mandibular inferior. And when you just lift this muscle, bifurcate, you will find vagus. Vagus will give two branches, upper one lateralis, lateralis. This branch, this is visceralis, which is going downwards, and one branch which is lateralis. They run parallel. Only thing is you have to differentiate between them. One which is going extremely downwards is called a, don't get confused with these membranes. These are muscles. Gills are here. So just above the gill you will find this lateralis, and first of all vagus. Trace out vagus. Vagus will give, this is vagus, and that will give two branch, visceralis and lateralis. Like this. Visceralis will give branches to the gills. Here we have seen already in this side. vagus. Okay, the lateralis and the visceralis. Below this is visceralis. They are very confusing. They are not like a diagram. Okay, you have to take care of. Diagram will mislead you. And visceralis will give branches to the gills like this. This is going to fourth. So fourth branchial, fourth gill. This is fifth, and this is third. Okay. You can keep or insert black paper here, piece of black paper. One more branch here, tiny. I think broken. No. I'll just try to trace it out. Yeah, it is deeper inside. See one more branch here. This is second. For fear of breaking, can you see this now? This is second, so third here and fourth here. Like this you have to trace them. That needs little patience, little time. So for that reason I'm not showing you all at a time. Then palatine, you have to take care of this cartilage. So beneath the vagus, this ophthalmic, you will find a lateral nerve here below that. So, you put water, it will shine and it will be visible. Yeah. If you see position no and remember them, it's very easy to trace all the nerves. Only you have to think what is what. Maxillar always goes to upper jaw. Mandibular goes to lower jaw. Optic goes to eye, and olfactory goes to nose. Anterior one, this is ophthalmic, that is going to ampulla of laryngealis. These velvet-like structure you come across here, these are all ampulla of laryngealis. These are sensory, and these all thick nerves are supplied to them because each ampulla of laryngealis receives one nerve. That's why a thick bunch of nerve ophthalmic is going to anterior side. Chemoreceptor. Okay, this is the end of our dissection.
Exam identification